Hey everybody, it's Skylar. You're watching my personal channel. This is my 2-month post-op update, and I'm going to share my chest and how it looks. And then I'm going to answer some questions from my Instagram. Sorry this is a little grainy. I'm hoping that you'll be able to see my chest well enough, but my camera is fucked up on my phone, so I have to use my computer. Okay, this is my chest. I still have that tan line. If you watch any of my other videos, you know I talked about it. But basically, I laid on the beach with ace bandage on when I was in Florida, and this is what happened. So yeah, I'm super happy with the results. I have a lot of feeling again. So I've been putting this stuff called Scar Guard on it. Dr. Garamoni recommended it, and I bought it there originally, and then I bought it for like hell of a lot cheaper on Amazon. So if you do go to Garamoni, don't buy the Scar Guard from him. Just buy it online. It's way cheaper. But it's called Scar Guard MD. I don't know if it's going to be backwards when you guys read this, but I can link it in somewhere. Anyways, you just paint it on here. It's got like a little brush, see? And you just paint it on. You know, like that. I'm not going to do it right now. I actually have some still on it. I don't know if you guys can see it. It's like a little bit of white there. But it basically is like nail polish, and then to take it off, you just put tape on it, and it just comes like right off. It doesn't hurt or anything. It's not like a big deal. It's just made to flatten the scars a bit, and to prevent like excess buildup. So I have a lot of Scotch tape. Anyway, so yeah, this is what my chest is like. I'll try to get closer, see if you guys can actually see how it looks. Super blurry, but it's not really puffy at all. It's just kind of, they're widening, obviously, because there's scar tissue forming in between. And, my muscles are coming back a little bit, not really. This nipple is more fucked up than the other one. It's like the scar around it, I don't know why, but sorry it's so grainy, but the stitches, where the stitches were, is like scarring a lot. Whereas this side, none. Like you can't really see. You can kind of see like there and there where they were, but really not. It's just much cleaner, and the nipple projects out a lot more. I'm not sure if you guys can see how much. You can kind of see the nipple projecting out. But this side, it projects out a little bit, but not nearly as much. So, I don't know what's up with that. So, I'm going to answer your questions now. So, Average Shithead on Instagram asked me to talk about stretching. So, as soon as I was allowed, on my 6-week mark, the first thing I did was go to swim practice. And obviously, when you swim, you do this. So, it was definitely super tight. I could do this, no problem. But as soon as you start putting your arms forward, you see how the scars kind of flatten out, and now they look like a kind of like smiley face. I actually haven't realized that. They look like a smiley face. Anyways, so when you do this, they stretch a lot. And there's a lot of tension for some reason right here on this side. The other side is less tense, but this tension kind of falls downward, and then, like, even the skin here feels a little bit tense, and maybe that's just because of my ribs. I don't know. There's definitely tension in the scars. It's way less so now, and so now I've been swimming for exactly 2 weeks, I think. I've done 2 full weeks of practice, and this will be my 3rd week of practice, and so it's definitely loosened up a lot. I can actually, in butterfly, you have to go like this, and then you have to press your chest in, and before I couldn't do that, but now I don't have a problem with doing that. I can do a full streamline. I can bend back, everything is completely mobile. It's just a little bit tight here on this side for some reason. But really, at first I was like, ee. But as soon as you get up here, it was fine. But then trying to put it in a streamline, the very first time I did a streamline in the water, it was like, whoa, it was like super tight. But the more you stretch it, the more it comes undone, and the more stretchy your skin gets. Your skin accommodates incredibly well. So it's not really a big problem. Somebody else had asked for advice on getting test gel versus injections or pellets or whatever. I don't have a whole lot of knowledge about that. I know I'm going to be starting on injections, and I will explain that later because I originally said I wasn't taking testosterone, but you'll learn more about that later. But I think Testagel is fine if that's what you want to take, and it's slower progress, I think, and it's like more controlled. So if you want to do that to like slow down the process of changes, then for sure take Gel. I just think it's like annoying because it's literally a gel, like a lotion you put all over your chest or your body, and then you can't touch anybody else because most other people don't want excess hormones. Especially if you have a partner who's a woman, you have to wash it off before you get intimate or touch her because she probably doesn't want to have male hormones on her. So I personally want to take, injections because I don't want to have to wash off hormones from my body, and I don't want to be scared of getting it on anybody else. So 2 people asked about the scars. One person said, could the scars go away completely? And the answer is no. And somebody asked me in this last video as well. No, the scars will never completely disappear. They will not. They were there forever. Somebody else asked, which was actually a really good question, if I could get rid of them magically, would I? I'm sure some days in the future I'd answer this question yes, emphatically. But I think overall, I wouldn't, because it would be erasing a past in my history, and I have a rich history that I don't want to erase. So no, I don't think I would. Okay, a lot of people have asked me about testosterone, if I'm on it. No, I'm not. Why I'm not on it. Why did I do top surgery first? Am I on hormone blockers? Blah, 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 blah. So hormones, everybody. I am not on anything right now. I do not take anything except for vitamin C and other vitamins and what I put on my chest, but I'm not on any hormones. I decided to get top surgery first because initially I wanted the option to swim on the women's team, and if I had taken testosterone, I wouldn't be allowed to swim on the women's team, so I would have to swim on the men's team. So I wanted the option to do that. I wasn't sure how I felt. I wasn't sure how much I wanted to go forward in this process yet, speed-wise. Not that I didn't want to do it eventually, but I wanted to give myself opportunities and time. I'm not on hormone blockers. I think I might go on Lupron at some point just because it might help, because I'm not getting a hysterectomy soon because I don't want more surgery for a little while. I decided not to take hormones again because I wanted to give myself the option in terms of swimming on the women's team or swimming on the men's team. And the last question is, will I go on hormones? And the answer to that is yes. I have an appointment May 13th. We're going to see how that goes, and hopefully I'll be on hormones by the end of May, but we don't know yet. Somebody else asked about my gender marker and if I could get it changed even though I'm not on testosterone. The answer is yes. Dr. Garamona gives you affidavits to change your gender marker. It says that I am medically diagnosed with gender identity disorder and that my gender identity has been diagnosed as male or whatever. So yes, I have the paperwork and I'm going to be doing that shortly. I've already changed it, or I'm in the process of changing it with my college. I'm going to legally do it with the U.S. government and my driver's license soon. Suits. People have asked me about suits. I think I'm going to answer this in another video as well, but I'm currently wearing a woman's suit because I was going to be on the women's team, but very shortly I will be changing to a men's suit and getting down with all of that, and so I will be wearing a men's suit, but right now it's just about what gender that I portray on in the pool. So I'm still on a woman portrayal in the pool, nowhere else. And actually people look at me really funny when I take my shirt off and I have a woman's suit on underneath, but that's just the way it is right now. And hopefully soon I'll be in the men's suit, but I also just don't feel super comfortable because I'm not on T yet and my body is still, my hips are blah blah. I mean, there's still dysphoria, unfortunately. Somebody else asked how tall am I. I'm 5'7.5", but I just say on paperwork I'm 5'8". Maybe I'll grow a little bit or something. I don't know. But yeah, I'm around 5'8". I'm not that tall. I'm not short, but I'm pretty short for a swimmer, whatever. Okay, so I think that was all the questions. If you guys have more questions, feel free to message me or comment it in below, whatever you feel. I'm open to lots of questions. I don't get offended easily, so feel free to ask questions. I have another video that I just posted also about my transition in terms of swimming and which team I'm going to be swimming for. That has a little bit more about the swimming portion of all of this. So I've mentioned it here and I've mentioned hormones, but if you want to, understand more about that process, go check that video out. I'll link it in. But yeah, I hope you guys enjoyed this video. I hope it was informational. This is my chest. It's super stretchy. I can do whatever I want. I have full motion. It feels good. I have mostly feeling everywhere except for, there's limited feeling on the nipples, but I have feeling and it's also super itchy all the time, which is weird. I don't have feeling on the scar, but pretty much everywhere else I do. I'm able to do everything, pull-ups, push-ups, weights. I haven't done a whole lot of weights recently just because I've been focusing on swimming, but yeah, so 2 months post-op, feeling really good. Yeah. All right, peace out, everybody.